Hey everybody, Dr. Brian Prax here talking to you about a way to potentially cure your pain. Cure your leg pain, your back pain, your neuropathy. I have to share this with you. Now I can't share the patient's name, but we'll call her Maria, okay? So Maria consulted with me about a month back about this strange leg pain that she started feeling. She said it happened after cleaning her bathroom about a month ago. Experienced it as a Charlie horse in the hamstring. And then the pain moved up to her quadriceps. Then it was on the front side. It was affecting her shin, her calf, the buttock, the whole entire leg. There was no backache. There was no real knee ache. She went to her doctor. Her doctor sent out for x-rays of the knee. Knee looked clear. Massage therapist said, yeah, there's some tight muscles in here. This is defined as one of those weird situations. Now, knowing the neurology like your neurologist or knowing the neurology like I do, there's the sciatic nerve that runs down the back of the leg. That might explain some of that. But that's a totally different nerve that does the top of the leg, the side, the front part of the calf, the lower leg, etc. So to me, this was like one of those weird scratch your head sort of things. I did an exam. I checked the muscles, the quads, the hams, etc. And they were weak. There was definitely weaknesses. There was definitely tender spots when I touched and palpated around there, but nothing was really explaining. So, as always, I went deep on the examination. And more so, I went deep on the history. So I'm finding out what medications do you take, what are your doctors prescribing, etc., etc. And the only thing I got from her was that she was taking a cholesterol-lowering medication called lovastatin. Statins are known to cause leg pains, back pains, and cramping. And I thought, this sounds very weird, and it just doesn't seem like it's a neuromusculoskeletal thing such that our cases would take care of. So I strongly suggested that she visit with her doctor and check in with those statins. Turned out she had been taking the statins, she said, but just in a small dose, only 10 milligrams for the last 10 years. I said, you should check with your doctor. See about getting off those medications. Long story short, she sees her doctor. He says, I don't know. Let me send you to an orthopedist, right? That's the knee and the leg specialist. So sure enough, she goes to the orthopedist and she tells him, yeah, I saw Dr. Prax and he suggested maybe it was related to the statins. And the orthopedist said, well, let's give it a try. Why don't we'll take you off those statin medications. You know, it was about a week, 1 week, and the pain had vanished about 50%. I think it was 2 weeks, maybe 3 weeks later, she said, completely gone. Now, she came in on one of our specials, I think, that we had in Facebook or maybe a local newspaper ad. It was $47. Literally, that is all I did. I just said, hey, let's see about these medications. And I don't want to say I'm taking credit for it, but why does it have to come down to the chiropractor to say, check in with your medications? Why aren't your doctors checking this? So one of the things that you can check for your neuropathy, your peripheral neuropathy, your back pain, your leg pain, your thigh pain, one of the things that you really should check are your medications, because one of the very common side effects of medications like statins, and they're definitely well known for it, is muscle aching, cramping, pain, and weaknesses. Sounds a lot like neuropathy. So I'm here to help you. If your statins or your other medications are not causing, there's a lot of other causes for it. I'm not saying to just throw all your statins away and all your medications away and see how it goes. You should check with your doctor on that. But we need to rule out what's called a statin myopathy. Did you know they actually have a diagnosis for it? Statin myopathy. Myo means muscle. Pathy means a condition of. It means that the statin is causing the medication. The medication statin is causing the pain. So anyway, with Maria, that was exactly the cause of the problem. That's the little tip for today. Check in with your doctor. You might even want to do a Google search. Google's excellent. You just put in lovastatin or whatever your medications are. Check all the medications, aspirin, check everything, and then you put side effect. Okay, so aspirin, side effect. We'll get more back on this, but that was an awesome leg pain case that I solved, and, well, I didn't do anything. So I look forward to consulting with you real soon. If you want more information, just hit reply. I will definitely see your reply here below and respond to it. Look forward to helping you and chatting with you in the future. Hope this has been helpful.